Thank you for having me today. I'm Peter Hotez, and I'm a vaccine scientist and pediatrician. I'm developing vaccines for poverty-related neglected diseases as well as coronaviruses, but also for years I've been going up against anti-vaccine groups because I'm the parent of an adult daughter with autism and wrote a book a few years ago called Vaccines Did Not Cause Rachel's Autism. And by default, I became an expert not only in the vaccine science, but vaccine anti-science. And in this brief recording and remarks, I'll talk about both. This is our group. It's called the Texas Children's Hospital Center for Vaccine Development. So I'm a professor of pediatrics, molecular virology, and dean of our tropical medicine school, but also co-head with my science partner for the last 20 years, Dr. Batazzi, a center called the Texas Children's Hospital Center for Vaccine Development to develop new vaccines for parasitic infections such as schistosomiasis, which, by the way, is an important women's reproductive health issue, causes female genital schistosomiasis affecting 40 million girls and women living in poverty in the African continent. And I've spoken to this group before about that, as well as vaccines for hookworm infection, Chagas disease, leishmaniasis. And then about 10 years ago, we started developing coronavirus vaccines for SARS and MERS, and then pivoted quickly when the COVID-19 sequence came out to develop that one as well. Whenever possible, we try to develop our vaccines using recombinant protein fermentation technology in yeast, because that process is in place all over the world's low and middle income countries, because it's used to make the hepatitis B vaccine. So countries such as India, Indonesia, Bangladesh, Brazil, et cetera, make their own recombinant hepatitis B vaccine through microbial fermentation in yeast. And we've done the same with many of our vaccines, so we can plug and play rather quickly. And the issue is to address this situation for COVID-19, the huge unvaccinated populations on the African continent and South and Southeast Asia, which of course gave rise to the Delta variant in 2021 and the Omicron subvariants later in that year. So the key is to try to vaccinate globally as fast as we can to prevent the emergence of new variants. And our COVID-19 vaccine, our recombinant protein, we worked with several countries, and the one that's furthest along is in India, where our partner there, Biological E, has used our technology to produce Corbevax, which has now been administered to more than 70 million adolescents, 12 to 14-year-olds, and now it's been approved as a booster for adults. So it provides proof of concept that you don't necessarily need a multinational pharma company to produce a widely used COVID-19 vaccine. And this one was done with very minimal public support, either from the US or from the G7 countries. And now we're in vaccine diplomacy discussions with Indonesia, Bangladesh, and Southern African countries to do the same, and providing proof of concept of how we can rapidly accelerate vaccines for global health, including our COVID vaccine, which has led to Corbevax in India. Now, the other thing that I'm very concerned about are not only on the right, the deaths from COVID-19, which by some estimates are reaching 20 million globally, but also the fact that in the US, if you look at this pattern of deaths, which is all too familiar from people now, how we began with that first wave of deaths from COVID-19 in New York in 2020, our terrible Alpha wave and our Delta wave and our Omicron wave, this big blue arrow represents May 1st, 2021. And that's the date that the Biden administration announced that anyone who wanted to get a COVID vaccine could get a COVID vaccine. And yet the deaths continued to mount because people were defiant of getting vaccinated, refused to get vaccinated, and led to, according to my estimates in my new book called Anti-Science Kills, 200,000 unnecessary deaths. So I thought I'd tell you how we got from here to that terrible place, and to kind of go through briefly the whole iterations of the anti-vaccine empire that I call version 1.0, 2.0, 3.0. 1.0, as I mentioned earlier, started more than 20 years ago with false assertions that vaccines caused autism. how it morphed about 7, 8 years ago to become a political movement, health freedom or medical freedom, and now is a globalized enterprise, unfortunately, or as I sometimes call it, empire. So let's look at 1.0, 2.0, 3.0. 1.0, even with that, it's changed and switched up pretty frequently. The original assertion was that the measles, mumps, rubella vaccine replicated in the colon, and somehow that led to pervasive developmental disorder or autism. And the scientific community responded in a big way, showing that kids who got the MMR were no more likely to acquire autism than kids who didn't. But then we got into this pattern where anti-vaccine activist groups kept on switching it up or moving the goalpost. Then they switched it over to thimerosal preservative or spacing vaccines or alumin vaccines, and there was no truth to any of that. There were no links to autism. And then, as you know all too well, there were false assertions claiming that the HPV vaccine was causing infertility and autoimmunity. And if that sounds familiar for COVID-19 vaccines, that's where they got it from. They just copy-pasted the false assertion from HPV and copy-pasted it onto COVID-19 vaccines. And I got involved because 20 years ago, because I have one of my adult kids, Rachel, has autism and intellectual disabilities. And I wrote this book that went into a deep dive showing there's no link between vaccines and autism, and what autism is and how it begins in early fetal brain development. And I think that was important because it did took the wind out of the sails a little bit, even though it involved a lot of name calling on their part and a lot of aggression and threats. I became known as the OG villain, which I thought was kind of interesting. But I think it forced the anti-vaccine groups away from this link to autism. Unfortunately, they regrouped in a way I would not have predicted around this phony banner of health freedom, medical freedom, basically after so many kids were opted out of vaccinations in Southern California. A measles epidemic occurred. The California legislature responded appropriately by shutting down vaccine exemptions, but this led to a backlash and helped to fuel this health freedom movement that basically said, you can't tell us what to do with our kids. And unfortunately, it really accelerated where I work in Texas. They formed an anti-vaccine political action committee, anti-vaccine PAC, and we wound up having now more than, it says here 70,000, but now a year or two later, it's up to 90,000 kids denied one or more access to one or more of their vaccines, particularly in the suburbs of Austin and up in some of the North Texas county. And that's what's with us today. This is what's accelerated during our time of COVID. To go national. And what you're seeing again under that banner of health freedom, medical freedom, was a strong partisan divide and unfortunately began in Texas. So here's May 1 over here, and you can see that all the deaths from COVID, or most of them, are in red states, and the redder the county, as measured by voters, the greater the loss in life because of vaccine refusal. And this is very tough for me to talk about personally because, as physician scientists, we're not really supposed to talk about partisan divides and Republicans and Democrats and liberals or conservatives, but that is the reality. And my feeling is the only way to talk about it is to talk about it, not to change people's conservative beliefs, but to say, to de-link it from these anti-vaccine sentiments, because so many people are losing their lives. And now what we're seeing is this is spilling over into other childhood vaccines, and unfortunately including the HPV vaccine. So things are going to continue to accelerate and worsen, and that's the topic of my new book. And now, unfortunately, what we're seeing is that same US-style anti-vaccine rhetoric and memes and false documentaries and this kind of stuff is now in low and middle income countries. So I'm very much worried about reversing global goals, and I hope we can have a discussion about that after this. So thank you again for having me. An honor to be here, and appreciate your time today.